what is causing so many men's penises to fail?
Well, it's a lot of things, but I will say probably the biggest one is there's an increase in obesity and heart disease, which means that you're having conditions like high blood pressure, high cholesterol, diabetes more commonly, and those are reducing blood flow to the penis and causing more erectile dysfunction. So I tell people, stop searching for supplements, start looking at yourself and see what you're eating and what you're doing for exercise, because that's going to be the number one thing to keep your sexual function intact.
Right. So by losing weight, by living a healthier lifestyle, getting more sleep, maybe more morning sunlight, reducing stress levels, that will lead to less erectile dysfunction.
Yeah, and those are all part of it, right? Getting good sleep is going to mean you're going to be in a better state of mind, and you're getting good circadian rhythm, which is getting good sunlight in the morning is going to mean you get better sleep, and all those things play a role in your day-to-day functioning, right? So those are things that people, I think, I'm glad you mentioned them, that people don't really focus on as big important things, but I think they're super valuable.
What about in terms of diet? Are there specific things to avoid in terms of this specifically?
Yeah. So sugar and flour, right? Like those sorts of things. If you look at all the diets that are out there that are, there's keto, there's paleo, there's whatever, right? There's like 100 different diets, but the key thing that all the diets have in common is reduce your sugar and increase your fiber and reduce your flour intake, like your processed and your flour intake. So that doesn't mean that you can't have grains or other things, but white flour, sugar, anything that looks like a mound of white when it's on like sugar and flour, avoid those things.
Amazing. I'm gonna go to my grave, I feel, on this show talking about this. What, if any, role do you think that pornography has in this?
Yeah, so it's a big role. Certainly, I think more and more of this younger generation is getting access to porn very easily, right? And I think back even when I was younger and my my male friends and my partner and everything, it was a little bit more difficult to access porn, right? You had to get a video tape and find a place to play it where there was no adult around. And so it was really much more difficult to access it. And now it's at the touch of a button. So I think one, and it does, if you look at data, it actually changes the way your mind kind of perceives, it's the same sort of dopamine cycle in your brain as for some people that lights up when you have addictions, right? And so you get addicted to seeing pornography, and then that, stimulates you, but then as you watch more and more, you need more aggressive pornography or more amounts of it to get that same level of dopamine rush. And that can create problems in your general sexual life, right? You won't find a regular person or regular sex, which is very different than pornography, right? Pornography is completely edited and altered. If your audience doesn't know, I mean, there's not that amount of semen coming out. There's not that quick amount of, less lack of foreplay. Like all those things are incredibly vital in having a good sex life. So I think when you watch porn and think that that's what it's like, especially for young kids, they then take that to their first sexual encounter, and that's not great. And then they're like, why am I not performing? What's wrong with me? And it's really because their expectations are wrong, and that's not how normal sex or physiology works.